Hello, everyone. Valerie
Hi.
Stern and I are back, and we're talking about now. We've talked about products, we've talked about internals in the past. What we're talking about now is procedures, technology,
Yes.
okay? And one of the things that we deal with all the time is people come in and they've had certain things that basically have done nothing.
Right.
And we're going to talk about the different things that we use and why we believe in those and because we're all very much about the best tool for the job that
Right.
gives people the best results, the most quickly, the most expeditiously, and with the most long lasting. And we also care about your pocketbook, and
Exactly.
we're trying to give it to you for the least amount of money. But let's talk about first and foremost. When you have the best technology
Right.
and the fact that it's operator dependent.
Completely. You could give me a Ferrari and I can wreck it for you easily. No problem at all. You can give somebody that's experienced with a Ferrari and they can make that thing sing. Same thing with the lasers. You can take a laser, I think we've all seen these advertisements for different name brands. You've heard of the Ixels, the Fraxels, the Pixels, the this, the that, the whatevers. And there's always some great new, come and have this done. It's always
It's gonna absolutely turn back the clock to you're 16 and you're gonna be suspended in animation, etc.
Exactly, not to mention the model that they use to show you is already 16 usually, anyway, maybe 21. But anyway, the bottom line is you can take a piece of equipment. You and I, of course, we work very similarly, so we would do the same job with it. But you could give it to 10 different practices and probably see different results. And that's because it is
Major
different results. Time dependent, temperature dependent, deciding which candidate is the right one for the treatment.
It's about the aesthetic eye. Number one, choosing
Yes.
the technology first and foremost that's right for your problem.
Exactly.
And we're going to go through that, but one of our pet peeves is this. We send, for instance, let's talk about what we use first and foremost, okay? So after skin products, and we're evaluating you, we're going to do a video on that about how we individually evaluate you and figure out what to recommend. And medicine's an art as well as a science.
Exactly.
Okay? So it's all about the aesthetic eye, and it's just like you don't want somebody injecting who's no good at looking at you and saying, "Oh, you need this. I see this asymmetry."
Exactly.
You want somebody who has the right aesthetic eye, but it's the same thing with technology because the person who's delivering the heat, the cold, the whatever, the technology, even if it's the world's best technology, is only as good as the person who's doing the procedure.
Completely.
So one of the things that we often start with, okay, and look, we've got all the tools at our disposal, but one of the things we first start with is Forma, for instance, because it has no downtime.
Exactly.
Okay? And we often have people who are coming to us for bigger procedures because they entrust us with that. And so we may say to them, okay, go and get Forma done in wherever you are. We try to find somebody who seems to be good at it, and we say to them, this is the way we would do it, okay? But, for instance, when we do Forma, we're doing your face, eyelids, and neck. It takes us, depending on the size of your face, anywhere from 2.5 to 3 hours.
Easy,
Because it's all about the amount of time you spend determines how good the result is. And we have people who come in and they went to some place who's supposedly fabulous, has a great reputation, but they did it for 20 minutes.
Exactly. And we're not talking 20 minutes on one eye. We're talking 20 minutes for the face, the neck, and the eyes.
And you're not going to get a result.
No.
You may get a result for 24 hours.
Exactly. You're going to see maybe a little bit of heat changes and whatnot, but that's going to be about it. I've spent many, many years, as you well know, because that's kind of how you and I met. I also not only worked in dermatology, but I also trained for 2 very large international laser companies, you remember. And I would go and train, and it never failed. There was always somebody that I knew that was the person that I would want working for me because they knew how to perform. They understood the parameters and they had that aesthetic eye.
And they cared.
And they cared, exactly.
And they were meticulous.
Exactly. I mean, when I look at somebody and I see the face, it's like, okay, this is where we're going with this. This is how we're going to do this. And you can just feel it while you're performing the treatment.
You see it.
Exactly.
If you're doing it correctly.
Exactly. But then there were those that weren't really interested in performing. They were getting a paycheck. You know, the practice was just something they did part-time or whatnot. And they were like, you know, so we do it for 10 minutes. You know, we get them in, we get them out, and we move on. That is not how this stuff works.
And it's betraying your trust, your time, your precious time, and I don't care how much money you have, you don't want to waste it.
Completely. You can have billions. It doesn't matter. It's a waste of your time and your money. And no billionaire that I've ever come across is throwing their money away like that, or they wouldn't be a billionaire.
So okay, the other thing is this. If anybody had a magic wand that could suspend you in animation, turn the clock back to you being 16, we would all have the magic wand.
Completely. Yeah, we'd have it.
And none of us have it.
Exactly.
At
Well,
this point.
obviously, I've not seen it.
Time marches on, and the most we can turn back the clock, in my opinion, visibly, is 10, maybe 15,
Yeah.
maybe 20 years. What's your opinion on that?
I agree with you on that. I mean, there have been many research articles that have been done where they've actually looked at individuals 35 to in their 70s to determine how much we actually lose per decade, so to speak. So from 25 to 35, 35 to 45, and so forth. And it tends to be, you know, when you get from 35 to 55 even, that's a good centimeter to centimeter and a half in all the different directions.
Yeah.
So if we can take something like Forma, which again, no downtime, very easy to perform, and help to bring back and lift and form new collagen and give that structure back, we can take time off of their face by adding collagen
And we're slowing
rebuilding.
down the clock.
Exactly.
And then when you combine it with skin products and internals and exercising and eating healthily and all the things we try to do, and Form is something that we use once, twice a year. Sometimes we do it more than that with
Right.
people. It depends. It's a no downtime procedure, but if you don't do it right, it's not going to work. So I don't care if you've got the strongest lifting and tightening technology, not going to work if you don't do it correctly, and that's the problem in so many places. Now, some of the other things that we use. So there's also Clear Lift.
Right,
Let's
Clear
talk
Lift.
about that for a second.
ClearLift is another great one. Again, getting on the same page here with the no downtime sort of thing. This is something that's been referred to as what's called a lunchtime lift or a lunchtime peel. I'm not really crazy about that because it's not really a peel. What it is, it's a certain wavelength that's designed to kind of target the reds and the browns on the surface while penetrating deeply and attracting the collagen and helping to stimulate new collagen production. So we get a bit of a lift and a tightening as well as an overall improvement in the pores and in just the way the overall skin texture and tone appear. It is a great treatment. It's very easy to perform. There is no downtime with it. That's what we did. Remember when we did that on you that one night?
And eyelids, around the eyes, and then if you combine it with your skin, you're being exfoliated, you're using your Retin-A, your vitamin A plus, your vitamin C, you're gonna make more collagen in response.
Exactly.
And it's also with some of the high dose peels we have as well. All these are tools in the toolbox that we choose. But again, with Clear Lift, you can't just do it for 5 minutes.
No, not at all. It's got to be done right. There's no question about it. And again, you know, being somebody that has gone out and trained these people and so on, you can't just do this and be done. You have to target that area that you're going to treat, and you have to target it for so much time while you're doing it in order to get
Clear
those
Lift
tissues
usually
changed.
takes you how long to do it?
Depending
a face, eyelids, neck.
Oh, easy, an hour and a half. Easy.
So,
lunchtime treatment, I don't think so unless you have endless
It's a
time
little bit longer
on lunch.
for lunch, right? And you don't need to eat. So the other thing is, okay, so the other things we use is, let's talk about Morpheus, IndyMed, Intensive, etc. Let's talk about those.
And you know, one thing I want to mention too is the synergy with all of these. There's a great amount of synergy that we
Synergy,
need
very
to
good.
have. we're trying to induce collagen formation. We're trying to get that collagen down below to do its thing and to build new collagen and repair old. So when we do it with maybe a peel or a laser or like Forma or Clearlift, we're getting the results that we want. But when we add another modality in there, we create synergy.
And
So,
the deeper,
yep.
we're trying to go all the way down to the muscle. Look, we care about the bones, keeping the bones thicker because it really matters.
Absolutely.
The teeth thicker, but then we bring in things that penetrate more deeply,
Right.
and that's when you have downtime.
Absolutely. And in some cases, downtime is necessary. As we know, we've got a lot of great tools that we can use when somebody needs to look really great, for an event tomorrow night or whatnot. But then there comes a point in time too where we just got to clean house every single year or whatever and just do something.
And renovate.
Exactly, renovate.
Yeah.
Just kind of really just take care of what's going on. And sometimes those do require downtime depending upon the person, their internal health and what's going on externally. And when we do this, we can combine these, or we can use something more aggressive and just give them a much stronger treatment. With
And that
something-
means more lifting and
Yes.
tightening, more collagen production, more volumization.
Absolutely.
And also, so what is downtime defined by? Look, some people get swelling, some people get some redness, some people get some little scratch looking things on
Right.
their skin, some people get some little red spots. We can give you a bruise despite our best efforts. It has nothing to do.
I've been bruised. I mean, it is what it is.
We need the chart that has all the millions of blood vessels that are here. We can see them sometimes with our eyes. Sometimes we can see them underneath the magnifying glass, but we can't always see them. So despite our best efforts, because we don't want to bruise you any more than you want to be,
Right.
we can get a bruise. So downtime, but in return, you get more lifting and tightening. You get more volumization, meaning thickening, because your skin thins as you go down the path of life.
Absolutely. And the bone demineralizes, the muscle thins out. So it's a combination of all of those
Which
factors.
is why we care about hormones and whatever, because
Exactly.
of the muscle, but also surgery, okay,
Yeah.
versus technology. So we do plenty of eyelid lifting
Right.
with the IndyMed Intensive, with the Morpheus,
Forma.
and Forma as well.
Microneedling.
Absolutely, microneedling, peels, everything that you're using on your skin. But remember that eyelid laxity is not just the skin, nor is your face. It's your bones, and your muscles are thinning. Your eyelid muscles are getting weaker, which is again why we care about the hormones, because that impacts it, makes them
Right.
weaker. And so we want things that penetrate deeply, okay, that try to lift and strengthen the muscles.
Right.
And that again is where we have to go to things that are more downtime. So around your eyes, all those surgical blepharoplasties can be done to a certain extent without the downtime of surgery, and also not the scar that you're
Right.
stuck with forever, and also the lymphatic, all that redness, the
Exactly.
little veins that they get from the
Asymmetries.
incisions, the asymmetries, etc. So we try to go with technology, but that's why we have to go to stronger technology. Now, then there's threads, okay? And so technology has to be done before threads.
Right.
Because once you put threads in for really a good 6, 7, 8 months post, the technology can melt the threads.
Absolutely.
And then let's talk about cold versus hot, okay? So with technologies that are cold, the freezing things, have you seen, like I have, all the number of people who have where things are frozen and scarred,
Yes.
and
Asymmetrical and lumpy.
and
And-
lumpy and asymmetrical?
More unhappy with the result than the actual problem they went in for. Because at least the original problem might have been a bit of a thickness throughout, but it was symmetrical. Now it's lumpy and bumpy and scarred and it's discolored or whatever. And now they can't even show it. So there are instances where we've had to take such things like the Forma or the EndyMed system or whatnot, the radio frequency, and try to help to symmetrize.
Evolve, where it's
Yes.
key. we have to take the heat to remodel the scars. And so we always go with heat and radio frequency rather than cold, because in our experience, and again, medicine's art as well as the science, but we've had a lot of experience between the two of us. The cold, you can have a lot of problems. With heat, the worst that can happen is that you don't melt the fat enough,
Right.
or you don't tighten enough. But then and also let's talk about this, the fact that there's not one magical treatment if only they find it. That, I mean, it's not that we're not doing it well enough, that technology and the body
Yeah.
will respond to only so much at one time. You
Exactly.
have to do things a number of times
Yeah.
to get the results, and we don't suspend you in animation.
Exactly,
You
yeah.
keep aging.
We're not living in a vacuum. And that's right, it does take more than one treatment. You really do have to go for it with a series, so to speak. And then again, this goes back to internal health as well. You know, you could take 10 people, all the same age, all the same problem, and we could do the exact same technology for the exact same amount of time on all of them, and 5 of them do one way, one another way, and a few more a different way, just because of their internal well-being. So, you know, if there's something off internally also, it can affect that. So being prime, or being as healthy as you can be from the inside out,
Really
is
matters,
always going to make a
including
difference.
exercise.
I think it was even you that had mentioned to me that, you know, the skin is an organ, of course. It's the largest organ. It's the last one to get fed, so to speak.
The last place the body will
It's-
prioritize its limited resources.
Exactly. So when you think about that, if your body is trying to take its resources and keep things going, it isn't going to focus
keep
on
you
the skin.
alive.
Exactly. So when we go to do these treatments and form the new you or whatnot, we might be dealing with a body that's saying, no, I don't have time to deal with that skin right now. I've got bigger issues. So optimizing the internal health is going to be key
Really
in
matters.
this.
Okay, so the other thing is, let's talk about carbon dioxide and O2. Look, it's a very European thing. It's not so much in this country. It's a crying shame because it works really well.
Very much so.
And
I'm
it's
in love with
synergistic.
this. It's way synergistic.
And so talk about injecting like O2 for melting fat in your thighs, your saddlebags, your wherever.
Yeah.
And
O2
CO2.
for melting fat anywhere, although there is a limit to the amount we can use.
Exactly.
So we do,
At
you know,
one
some
time.
of us are like, wait, just everywhere, and
Yeah.
we can't do that. So we have to prioritize and, you know, maybe come back another time for
Yeah.
another area. But I just had a patient today, as a matter of fact, who emailed me, and we had done a couple of Lumecca treatments on her, which is IPL for
We
brown
talked about
spots
that,
and
yeah.
reds. And her skin is looking beautiful. She's really pleased with it. People are really noticing an improvement. You know what she's focusing on now?
The fat
This.
underneath here.
Yes. So all of a sudden, now that she's got this beautiful canvas going on her face, all of a sudden she's starting to focus on this. And we do this, we all do. Something gets fixed on me, I focus on something else,
Yeah.
and we go that route.
That's no longer ruining your life.
Exactly. Something else is
Yeah.
always there to take its place. But anyway, so I got to thinking, you know, what could I do for her next? And the first thing that came to mind, well, 2 things came to mind. Synergy was number 1, but it was O2, maybe a little CO2 as well, but then also doing Forma, because those are going to work together to help to break down that fat with the O2. The O2,
And it burns the fat.
O2
or-
gas,
yeah,
yes, it actually
breaks it down.
almost, I don't want to use the word
Dissolve.
digest it, dissolves it, or
Yeah.
just basically rids that area of it. So as you're doing that, and then you put in a little CO2 to kick on those stem cells to bring the skin up to tighten, and then a little Forma over the top, you're not only getting stem cell activation inside out, but outside in. And the 2 of those come together, and you're going to
Or
have
the intermittent intensity you can
And-
also do.
completely.
But CO2, let's talk for a second because a lot of people don't know about this. CO2, when you blow carbon dioxide into the skin, it turns on the stem cells. They use it a lot with hair. The really enlightened people do hair. With hair, they blow CO2. It helps turns on the follicles because the follicles are starting to get depleted. And so it helps turn on the stem cells in the follicles, which are deep in the scalp. You put it in the face. We often use it, combine it with Forma, etc. Put it in the face. Put it anywhere. Arms.
yeah.
It helps tighten up cellulite, etc. But like anything, you can't just do it once, expect there, yes, you'll notice the difference, but you've got to keep doing things because we're not
Right.
suspended in animation.
Exactly.
And with O2, you can only use so much, so you've got to come back and then you burn some more. You have to do it little by little, basically.
Right.
But combining things is really the other thing that so that when you come in one time, we may say, oh, we need to do a couple of different things at one time because it's going to give you a better result, and then you go away and you make new collagen, etc. for the next 3 months, 4
Right.
months, 5 months, 6 months, and then we see you again.
Exactly.
But again, you've got to do it. Some people when they blow carbon dioxide in, they only put 100 mLs. We may put 3,000-4,000 mLs,
Right.
and you get a better result. Because again, it's all about who's doing it, the
Right.
aesthetic eye, and doing it correctly, basically.
Exactly. I mean, one other thing too, I think, is
And
the
we
fact that
actually need to talk about.
yes, we've got a lot of patients from around the world, and we don't have the luxury of having them in the practice
All the
today
time.
and next week or whatnot. So doing things safely and doing things that work and doing things in a way where they are going to see improvement
And
is
as
key.
big a result
Exactly.
as possible, as quickly as possible. And then Lumecca, because this is the other thing. There's a lot of different things for brown spots, etc. But Lumecca is really,
Yeah.
And you've dealt with every technology
I've dealt
in
with
the
a lot of
world.
them, and I love it. I think it's great.
And it's great for hands, face. We look at people and everybody needs to have Lumecca at least once a year.
Yeah.
It does help with preventing skin cancers. Again, synergistic
Absolutely.
with your retin-A, your vitamin
Yes.
C, all the exfoliants, etc. But Lumecca, I think, gets rid of brown spots better than any technology I've seen.
It's working very, very well, and it does a beautiful job. Basically we do it in 1 or 2 treatments for the most part, as opposed to a lot of places where some
do
of
it
you
for
out
5
there.
minutes.
Yeah, 5 minutes, or they tell you to come back for a series of 6. You have to buy a package of 6, kind of a thing. I don't know. I just don't even
We
know.
do a stronger, more complete.
Yeah.
And again, this is part about technology. Technology is only as good as the person who's sitting using the
Right.
handpiece, basically, and their aesthetic eye. Now, the other thing is remember, again, I'm huge on remember your body as well as your
Yes.
face, your neck, your chest. Your skin products should be on your chest as well,
Everywhere, yeah.
everything on your eyelids. But when we do your treatments, we do face, eyelids, neck, and we're looking at your chest. But with Lumecca, etc., on brown spots on your hand,
Absolutely.
on your arms, okay? And then the other thing is, don't forget about your veins and things that you've got,
Right.
which is often the best to remain sclerotherapy. Do you agree with that?
I completely agree.
1064?
1064 does work, laser. It does work. There are people that do use it. I've used it. But I'm still a sclero person, and it's still the gold standard. Sclero, if you're unfamiliar, is injections. It might seem like it hurts a little
Closes
bit
up the
more,
vein.
but it really doesn't. Exactly.
And it
just
works
kind-
better
it
and
works-
more
It's
long-lasting.
more precise, I think. More long lasting, absolutely. So those spider veins that we all look, in January or February, and we're looking
Yeah.
at our legs going, oh my God. Those, and also too, you just don't go in and have that done. That's a process. So you're gonna look ugly first. You're gonna walk out thinking, oh my God. So if you have something planned, a vacation or whatnot, you don't wanna do this right before. You wanna plan this well in advance.
Well, the other thing that I'm huge on is using peels
Yes.
to thicken the skin. High-dose retinol peels, you don't have to prep for that.
Right.
High-dose retinol peels that people use at least twice a year, that they roll with the derma roller.
Beautiful, yes.
And then they put it on. In fact, I've got one on my legs right now. You can only use so much at one time, sort of like O2,
Okay.
because it's a fat-soluble vitamin, but it thickens the skin. And you can see where if you just come up to your knees and do your lower legs, or you just do your upper legs, you can see where it stops. It makes such an intervention with the skin. So again, you got to look at the whole body.
Absolutely.
And what's your take-home message about technology and doing it right? What
You know, basically, again, as we said in the beginning, it's operator dependent. So, you know, I honestly, you could give me any piece of equipment, I'm gonna make it work. End of story. Because I know what I'm trying to achieve. I'll find a way.
Maybe not cryo.
Well, maybe not
the
cryo.
cold.
Yeah, maybe
Yeah.
not the cold.
Yeah.
Never mind that one.
Yeah.
But the bottom line is knowing how to use it, doing it right in synergy, combination, combining these procedures
And
so
doing
we
them
get the optimal
correctly,
and
in
doing
the
them
correct order.
exactly, doing them in the correct order. If it's not done in the correct order, you're not going to get the results that you're looking for either. So
And the last take home I'm going to say, although it's not really technology, but I guess it is threads, okay? I'm a huge and increasing fan of threads, but again, you've got to have somebody who's got an aesthetic eye,
Right.
who looks at you, sees the asymmetries, just like with the lasers,
Yes.
not lasers, but technology, because none of them are lasers anymore, but who sees, you know,
Right.
what needs to be lifted
Right.
and how to do things. And there's threads now that, and a lot of times we combine technology with threads for filling in these lip lines, etc. Pulling up, we've done the technology, and then we put it in to pull it up even more for giving you more of a facelift. So surgery increasingly goes away, but only if you've got the people who are doing it correctly. Otherwise, you say technology doesn't work. Well, if you've got the
Exactly.
right technology, number one, and you've got the right operator who's doing
Yeah.
it, and that's the problem. So hopefully this helps you when you go and see people and you're interviewing them about how long does it take and how are you going to do it, and you've looked at yourself and looked at where, you know, this side is different than that eye, this side of your face is different than this side of your mouth, you know, one side of your neck versus the other.
Right.
And we've mentioned names of what we use because we believe that those are the strongest, best tools for the job that send people home happy and give them the best results.
Absolutely, absolutely.
Okay, it's a lot of experience right here. Thank you very much. Hope this has helped. And we're also going to talk about in another video how we look at people and evaluate them. Thank you.